Good evening, everyone. Welcome to today's session, organized by BALCO Medical Centre, a once state-of-the-art cancer hospital situated in Chhattisgarh. BMC is one of the most trusted cancer hospitals in central India, accredited by NABH and NABL, with over 3.8 lakh OPD visits and 60,000 patients till date. Today, we are here to observe National Cancer Awareness Day. This day reminds us that awareness and early detection can save lives. We are honored to have with us Dr. Divakar Pandey, Senior Surgical Oncologist at BALCO Medical Centre. Dr. Pandey has trained at the Tata Memorial Hospital, Mumbai, and has over 10 years of experience in treating complex cancer surgeries. Over to you, sir.
Thank you, Achal, for warm welcome. So I thank you all of you again who have joined us for this webinar. It's an interactive session. That's what we have planned today. So I'll have a brief uh, touch on what cancer is, and then we'll move on to your questions, and maybe we can take as many such questions as possible in the time allowed. Can we share the slide, please? Yeah. So Achal, we can start, or we have to wait for some time?
We can start the session, sir.
Okay. So, since 2014, we are celebrating 7th November as National Cancer Day. It is to honor the birth anniversary of Mrs. Marie Curie. She was the founding, and then she was the one who discovered radioisotope and radiation. So basically, there is one modality of therapy that we use for cancer, and she and her husband actually were very actively involved in detecting and diagnosing how to treat those patients with radiation. And unfortunately, she died of toxicity of radiation as well. So on her birth anniversary, since 2014, we are celebrating National Cancer Day. So when we talk about cancer, the first question that comes in our mind is that what cancer actually is, and why does our own body behaves like that? Why does our own cells grow uncontrollably, and because of that, cancer happens. So you all know that our body is made up of trillions of cells that grow and divide, and every cell has a lifespan. So every cell has to once the cell is has done its part, then that cell has to die. But sometimes what happens, the dying tendency of those cells are because of many genetic changes happening in the body, that stops. And because of that, they keep on growing continuously and uncontrollably. That is actually called as cancer. So they are all cells which are abnormal cells which has lost their tendency to die. And they can form a lump because they're overgrowing and there's no check on the cell death. And that's why commonly happening symptoms of cancer is a lump which is painless to begin with, and it is growing slowly without causing any difficulty, any ulcer in any part of the body which is not healing in like 2 weeks, 3 weeks, or any other symptom which is unusual. So right now, cancer is unfortunately one of the leading cause of deaths worldwide. And since you're uh, becoming an industrial economy, the numbers are increasing in India as well. And because of that, we need to have a very strong degree of suspicion and a community awareness to know what cancer is, what symptoms those cancers can have, and what are treatment options available, as well as the screening modalities available for cancers in our community. So my talk will be briefly focusing on these five aspects. Next, please. So, common cancers in India, in our part of the country, still tobacco-related cancers are most common. Tobacco can be of any form. It could be smoke tobacco or smokeless tobacco, which हम जो commonly we call it जर्दा, खैनी, or that pan masala. So इससे जो cancer होता है, most of the times, this is the most common cancer that we see in our area. So oral cancer, it can also cause oropharyngeal cancer. आपके माउथ के पीछे जो हिस्सा होता है, that's called oropharynx, वो वाला cancer. Then of course lung cancer if somebody smokes, and it can also cause a lot of other cancers like GI cancer, stomach cancer, colon cancer. Similarly, other common cancers in women basically is breast cancer. And then now we are having increased numbers of cancer patients who are coming up with endometrial and cervical and ovarian cancer. In rural part of our country, because of the poor genital hygiene, we still see more number of cervical cancer. So this is the common cancer that we see in men and women. In men, oral, lung, and prostate cancer. In females, breast cancer, cervical cancer, and the oral cancer once again. And then now we having increased number of patients coming to us with endometrial as well as ovarian cancer. Next slide, please. So, by and large, why does cancer happen? That was there in the previous slide. You must have seen that already. But there are tips to avoid cancer or tips to basically prevent cancer. They are, I have just enumerated them as A, B, C, D, E, F, G. So the most important thing in cancer biology is basically inflammation. So if the body is having more inflammatory cells because of various reasons. So one of the reason is of course the diet. If the diet is not a balanced diet or it has more non-vegetarian or red meat, or you are indulging in alcohol or tobacco, or if the somebody is obese, in those patients, on those individuals, the inflammatory markers are very high in our body. That leads to a lot of cell injury, and those cell injury actually leads to DNA level changes, and those changes can also lead to cancer. That is point number one. So uh, to tip so as per the you have to avoid alcohol, tobacco, and of course obesity. That is tip number A. Then tip B is there are certain cancers which are preventable cancer. We have got vaccines to prevent those cancers. So one of the most आपने सब सुना होगा, one is liver cancer. So liver cancer, hepatitis B, C के कारण से होता है. इन कैंसर्स को हम आसानी से बचा सकते हैं विद जस्ट सिंपल वैक्सीनेशन. सो देयर इज अ वैक्सीनेशन अवेलेबल फॉर हेपेटाइटिस बी. सिमिलरली देयर इज अ कैंसर कॉल्ड सर्वाइकल कैंसर. ये बच्चेदानी का मुंह का कैंसर है, फीमेल्स में होता है. उसके लिए भी वी हैव गॉट सर्वाइकल कैंसर वैक्सीन. सो giving this vaccine in eligible patients, actually individuals, actually can lead to at least complete probability that cancer will not happen. Then again, C is basically you have to keep yourself calm, do yoga and pranayam. That is again maintaining a good mental balance. Very important. It can also reduce your inflammatory markers. So that is C. Then you have to D is diet. So diet is probably most important part of our whole preventive this thing. So if your diet is rich in fruits, your diet is rich in fibers and vegetables, and you're taking meat, but majority of them is lean meat, and you're taking fish as part of your if you're taking meat, fish, and maybe chicken meat, that is better. Red meat, if you're taking for long time or and too much, that is not good for our body. So your diet should be rich in fruits, vegetables, and then mixed cereals. So you can have different colors of cereal, and that way you can actually prevent a lot of inflammatory markers that happens because of the poor dietary habits. E is exercise. Very important. You should at least exercise 35 to 50 minutes, 1 hour in a day. It should be moderate intensity exercise, includes both cardio as well as the weight bearing exercises. Now, there are studies showing that even in patients who have got cancer and were treated with therapies and they were cured of cancer, if you follow these all healthy lifestyles, the cancer will not come back. So again, exercise is very important part of our life, which we and in current generation actually many times it ignores, and that makes it produces good hormones in our body that leads to good mental balance as well as, and probably your efficiency also increases. Then you have to know your family history. The word F is to know your family history. There are certain cancers which run in our family. So you should know that if somebody had cancer in your first degree relatives, like your parents or maybe your uncle, aunties, or maybe your distant relatives, you should know that there's some cancers which run in our family. And if you are aware about those cancers, you can actually identify who can get those cancers beforehand. And then that way we can even get them identified in pre-cancerous stage, or maybe we can completely avoid them altogether. So that is very important. And most important, G is basically screening for cancer. So screening tests are those tests which detect cancer in early stage or maybe pre-cancerous stage. So there are certain cancers which take a lot of time to grow. So they have a pre-malignant lesion like a ulcer, which is non-cancerous. It takes 10-15 years to grow as a cancer. There are certain cancers which have pre-malignant diseases, which can later on convert into cancer. So, if you screen them, if you screen yourself as per the government regulations, as per the health regulations on time, and if you get screened in at least from the beginning, then maybe you can avoid those cancer. You can If you can pick it up early, the results will be fantastic as well. So that is very important. Screening is very important. So I'll show you, and I'll if you have any queries, I'll also tell you what are screening modalities are available for which cancers in coming slides. Next, please. So, what are the warning signs that you know of cancer? So, anything unusual in your body, you have to think something is not good. So, any lump in your body which is not, which is painless to begin with, and it is growing in size slowly, slowly, and even after medications, it is not going. That is one very important sign. Then anything unusual, I just told you, like any weight loss out of proportion weight loss or a fatigue which you're feeling low, that also might be a sign of cancer. Not say all these signs are cancer, but yeah, you have to think that something is not right. Then if you have persistent cough for many 2 to 3 weeks or maybe even more than that, and you notice some small blood spot on your cough, that is also one sign of either lung cancer or oropharyngeal cancer. Then any ulcer in your mouth which is not healing for 15 days. So generally, any mouth ulcer heals by 15 days if it is not cancerous. So it is not healing, then that is very important sign. Any abnormal bleeding anywhere, like it is bleeding from the during motion, during menses, any heavy menstruation, or even bleeding in between the menses, or anything which is unusual, like any bleeding from the gums or anything like that. That is also, if it is abnormal, then it could be a sign of cancer. And although last point, change in a mole or what, that is not common in our country, but skin cancer, especially melanoma, is very common in the Australian hemisphere. So so if you got a small mole in your body and it is there static for many years, but suddenly it has changed its appearance, it is increasing in size, or it is itchy, or it has changed its color. That can also be a sign of cancer, skin cancer. So these are the common signs of cancer. Next, please. Yeah, so this is the most important slide I feel. So in our country, if I include prostate cancer, there are five cancers against which we have got screening modalities available. Some screening modalities are also part of our national program, but some are not. So there are two cancers which where we can easily get screening done anywhere nearby. So one cancer is breast cancer, other is cervical cancer. So the breast cancer screening program, it's just a simple breast examination. You should know how to do a breast examination with your with palm of your finger. At least it has to be done at least once in a month for ladies who are more than 40-year-old. And we should also get a mammogram done. It's a X-ray which is not very uncomfortable, and it's an X-ray to detect the tissues in your breast, about the hardness of the tissue, about any other lesion is there on the breast or not. So that is done yearly, starting from 40 years. It's a very cheap and simple investigation. Similarly, for cervical cancer, we have got pap smear and the HPV DNA testing. So pap smear as well is a very cheap investigation, and it is combined with HPV DNA testing. So it has to be done in all ladies after age of 25 to 30 years. And if you're doing only pap smear, it can be repeated after 3 years. And if it is combined with the HPV DNA testing, it can be repeated after 5 years. So you can do it from 25 to 30 years of age till 65 years of age. And after 65, there's no need of doing a pap smear or HPV test. So that is for cervical cancer, which is very common cancer in our part of the country, especially in the rural areas. Similarly, for oral cancer, there's no screening modality available. But the first thing that I want to request all of you, and of course, you have to, like, you all of you who are attending the webinar, at least you should know that uh, oral cancer is the one of the most common cancer, which is actually a preventable cancer. It happens because of the tobacco or because of some chronic irritation in your oral cavity. So in our country, it is the tobacco, smokeless tobacco, and areca nut, that leads to these. So out of all oral cancer, almost 95% of them are because of tobacco. So one important thing is that you should tell your colleagues as well as who is chewing tobacco, you should stop tobacco in all forms. And you should also tell your colleagues to educate your nearby people. Other important thing is dental hygiene. That is most of the time not. Uh, it is kindly overlooked actually. So if your teeth are sharp, it can hit the tongue and it can cause lot of small injury, and that chronic injury pattern, healing injury and again injury and then healing, that might also lead to cancer. So a good oral hygiene is very important. Ideally, we should get dental checkups done once in a year. The dentist will also identify if there's a pre-malignant lesion is there or not. And if there's some teeth are sharp, then I think it needs to be grinded. So that is for oral cancer. Now, colon cancer. So we got multiple tests available for colon cancer. Again, it is starting after 45 year of age. But if some family somebody has genetic history of colon cancer in the family, it has to start 10 years before. So it has to start at 35. So we have three options in colon cancer. One is stool testing. So we are testing occult blood in the stool. It's like a small test where you have to give your stool sample, and then they'll go to laboratory and they send it for any blood in that stool. So that is occult testing. So it has to be done three once in a 3 year if it is, and it has to be done thrice for 3 consecutive days to call it negative. So that is a very simple test. Other option is a sigmoidoscopy and a colonoscopy. So a sigmoidoscopy is like putting a small endoscope from your rectum, and then left part of the colon is seen. That is called sigmoidoscopy. And colonoscopy is complete visualization of colon with that endoscope. So this has to be done every 5 yearly. And if everything is normal, then later after 70, it can be stopped also. Other important thing is if somebody is not fit for any, because endoscopies they sometimes they're painful. So other option is a CT colonoscopy, which is as good as colonoscopy, but it's like a CT scan. So it is available in some centers, not in all centers. Again, same, it can be repeated after 5 years. So these are the three common cancers where screening tests are available. Apart from that, there's a cancer called prostate cancer in males, where a simple test called a serum PSA level and a urological examination to just see the size of the prostate and the consistency of the prostate after 45 years is also good test that we can do. So that has to be done 2 yearly. So these are all screening tests, and these tests are very important because you're getting these tests done to check yourself that anything is wrong or not. And if at all something is there, it can be picked up early. And if it can be picked up very early in pre-malignant stages or even in early stages, the treatment options are quite good, and the cure rate is almost 100%. And at the same time, what do you say? The side effects of the treatment also are very less. So screening is very important. You should educate uh, all of your colleagues and yourself. You should also get screened. Thank you. Any questions from they are most welcome. So I think I have one question here. Yeah, so I have one question about cervical cancer vaccine. Yeah, so there are multiple options available for HPV cancer. So basically, what is HPV is that it's a virus, and there are multiple variants of, just like coronavirus. There are multiple variants of virus which can cause HPV, and out of them, some strains of the virus are dangerous. They can cause cancer. Some of them can cause just normal wart. So the vaccines are like they have got two types of strains, then four types of strains, or there are nine types of strains. So because of that, there are multiple varieties of vaccines available, and all of them are equally safe. Ideally speaking, if somebody is going for cervical cancer vaccination, ideally if quadrivalent vaccine is better than a bivalent vaccine, because it offers more strains and they offers immunity against more strains. And yeah, they're equally effective. The efficacy is close to 90% if we talk about the pre-malignant conditions like wart, and it is close to 85 to 90% if we talk about cancer. They also provide cross immunity against the strains which are not there in vaccine. Like if you got a uh, quadrivalent vaccine, and if uh, uh, you you get some other kind of wart, so they give protection against those kind of wart as well. So they're equally effective. Then I have other question. Yeah, so I think Kashish has asked a question. Are there any other way in which one can examine about cancer at home? So I think the most important part, the most important thing is that you should identify the symptoms first. And if you feel that these symptoms are unusual, like I mentioned, or anything that is not fitting into a normal pattern, then probably uh, it's not wise to delay it. Actually, you should just get a consultation. So that is, I think, a better way. Yeah, I have a question from Vivek that what are the recommended age for taking HPV vaccines? So HPV vaccines can be taken between age 9 to 14, and so that is before the sexual activity. We give two vaccines if you're taking between 9 to 14. If we're giving vaccine by any because of other reason we're doing it like after 14 years of age, we have to give three vaccines. Similarly, if somebody is immunocompromised, like somebody has some uh, diseases like HIV or any other immunocompromised diseases, there the even in early age also we have to give three doses of vaccine. So that is the recommended age, and we should give vaccine to boys as well as girls, both of them, because it prevents other things like anogenital wart or oropharyngeal cancers. So because of that, it should be given to both sexes. This is very good question from Rameshwar Tripathi. Increasing AQI, can it lead to cancer? Unfortunately, yes, it can lead to cancer, but we don't have enough evidence to say so. But at the same time, if you look at the kind of the petrochemical this thing kind of soot that is being produced and that is there in that pollution, it is like as good as smoking only. So that might lead to lung cancer. Because of that, maybe we are having a pandemic of lung cancer, and we are seeing a lot of patients with lung cancer recently. So I have other question for lung cancer again. Yeah, so there's no name, there's a number of only. Yeah, so for lung cancer, so lung cancer is one of the cancers where the research has actually changed the treatment altogether. When we were training, lung cancer in stage 4 was kind of not curable, and the survival also not good. Now we have got personalized therapy available for lung cancer. With that, these therapies are called targeted therapies and immunotherapy. If it is advanced, and with that therapy, patients are surviving for more than 10-15 years, even at stage 4. So yes, there are medicines available for lung cancer, but it depends on the stage on which it is diagnosed. And based on that, we either offer surgery or chemotherapy or targeted therapy or radiotherapy, depending on the stage. I have other question after that. Yeah, this is also a very good question. Good afternoon. Yeah. So alkaline water, high pH water is helpful. It's, I think, just a myth. There's no data available to suggest that having that kind of water is going to reduce the risk of cancer. They are very costly, and there's no data to back them up. So I had just told you what are the things that we can do to prevent uh, cancer, but taking alkaline water is not one of them. So definitely, it's just a myth. There's no data available to suggest it. So Kashish has again asked a question that what role does regular screening play in early detection, and at what age should people start? So the dictum is that they should know their genetic history, and if there's some cancer in your family which is running, in that way you should start doing screening test at least 10 years before the last member has been diagnosed with that cancer. So generally, if somebody starts at 40, in such patients we should start at 30 years. Similarly, breast cancer, cervical cancer, as well as colorectal cancer. There are screening programs available. I have just told you guys what is the average age we should start. Apart from cervical cancer, rest of the cancer screening actually starts at 40 years of age. In cervical cancer, we start at 25 years of age. So that is the usual age that we should start screening. Yeah, Sonali has asked that we should discuss the symptoms of cancer once more. So, anything which is unusual could be cancer. So one is if there's a lump in your body which is not it is not painful and it is growing slowly for very long time. Any ulcer which is not healing, even in spite of treating it, it is not healing. Again, that is painful. Then any cough that is persisting for more than 3 weeks or maybe beyond that, and if you have some blood tinge in the cough, that can be a sign of cancer. Any change in your bowel habit, like diarrhea or maybe constipation or constipation alternating with diarrhea, or you notice some small black stools or maybe some blood in the stool, that is also one sign of cancer. Any unexpected weight loss, if somebody is dieting, somebody has reduced their dietary intake, then it can. So anything unusual, and you're not gaining weight or you're losing weight, that can be a sign of cancer. Anything, something like fatigue, you're fatigued all the time, you got all the tests done, you got sugar testing done, you got BP testing, everything is normal, but even then you're having fatigue, that can be one sign of cancer. And in females, if there's a menstrual intermenstrual bleeding, bleeding in between the menstruation, or even bleeding after the somebody has attained menopause, but again the bleeding starts, that is also one sign of cancer. So Isha has asked, what are the early signs of cancer that should one should not ignore? So the warning signs are just like I just mentioned you, that if there's a lump which is not healing, and there's an ulcer which is not healing, or any lump which is painless to begin with and it is persisting for a very long time, these are the warning signs. And especially in early stage of cancers, the pain is not there. But once that it grows, it spreads to other areas of the body, it starts to have other symptoms. So you should not miss these important points. Yes, Rameshwar also has a very good question actually. Breast cancer is also seen in men. How can it be prevented? So breast cancer is seen in men as well, because men also have tissues which are limited number of breast tissues. Because of that, it can also uh, sometimes cause breast cancer. And in those patients, actually, the numbers are quite less. If you have breast cancer in men in your family, then you should get genetic testing done, because many times they are genetic also, and many times because of their hormonal imbalance in the body. So I have a question again for pertaining to lung cancer, that generic osimertinib medicine is good for lung cancer. What is the success rate? So osimertinib per se is a very good drug, and depending on your stage, depending on your genetic mutation, these drugs are prescribed. And the generic version as well as the original molecule, they don't have much difference. So that is my answer to this question. Yes. So right frequency for having pap smear test for females of age between below 30 and above 35. So we should get it done at least once in 3 years. That is the usual testing. But if you are combining it with HPV DNA testing, so then it can be repeated after 5 years. And starting is 25, age of 25 years. I think we've taken all the questions, I feel.
Yes, sir. As of now, we have taken all the questions.
Yeah, yeah.
I think we can wait for another 2 minutes.
Yes, yes, yes. Or
And
we can unmute if someone has questions, somebody want to speak, they can speak.
yeah, if anybody has any question, please let us know in the chat box and we can unmute you. Also, in the chat box, I'll be putting Dr. Divakar's email address. So later on, also, if you have any questions, you can email sir. If there are no further questions, I think we can conclude here. Thank you everyone for joining in today. And again, as I mentioned, I have put Dr. Divakar's email address in the chat box. If you have any questions that that you would like to be answered, you can email sir. Thank you so much for joining in. Thank you, Dr. Divakar, for such
Thank
an
you, Achal. It was a
informative.
pleasure hosting all of them. Thank you.
Thank you so much, everyone. Have a good evening.
Thank you.